Laparoscopic ovarian drilling is one of the surgical procedures suggested for women with polycystic ovaries and who is anxious to conceive. In this video, we'll try to elaborate on the indications for laparoscopic ovarian drilling, what are the contraindications for laparoscopic drilling, and what is the procedure for laparoscopic ovarian drilling. The most important indication is when the woman fails to ovulate with oral or injectable ovulation induction medicine, where the women, in spite of having a regular ovulation, is not able to conceive because of high LH level, or third is when there is very high levels of LH level, in which patient we should not be considering laparoscopic ovarian drilling. Any woman with PCO who is more than 30 years of age. Why? Because we know that when drilling, ovarian reserve can come down. Second, who is having regular ovulation with ovulation induction medicine but is having a normal or quite a normal balanced LH level. So, whenever we are suggesting laparoscopic ovarian drilling, we should counsel the patient regarding the positives and negatives, and also tell them the options of IVF treatment, because we know that many of the patients, even after laparoscopic ovarian drilling, may require some kind of a fertility treatment. We use 3 ports with 5 mm of each. Before starting laparoscopic drilling, we need to do tubal patency test. Next is, we need to stabilize the ovary either by holding the infundibulopelvic ligament or ovarian ligament with a atraumatic gasper. Stabilize the ovary and then use monopolar current. The tip of the needle should be not more than 4 mm. The energy should be around 40 joules, and we should not go more than 4 punctures. So this is rule of 4 punctures, 4 seconds, 4 mm length of the instrument, and not more than 40 volts of current. This is a general principle, but we can calculate or individualize the punctures depending upon the volume of the ovary. It is simply calculated as 60 joules per centimeter cube of the volume of the ovary. How do we calculate? 4 into 4 into 40 generates around 640 joules. Now, if the volume of the ovary is 20, then you may need more puncture. Once the puncture is done, we need to immerse the ovary into the fluid or in normal saline so that it cools down faster, thus avoiding lateral spread and injury. After the puncture, thoroughly wash the ovary, pull the ovary, take out all the blood and the clots and the black estuary which is formed after the puncture, because leaving back the blood and the estuary may cause adhesions. Thank you for watching this video. For any more queries and doubts, you can reach to us.